Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Opening this spring, the Jack and Sheryl Morris Cancer Center is a state-of-the-art freestanding cancer hospital featuring outpatient and inpatient capacity coupled with research laboratories, retail space, and ancillary services devoted to patient wellness. It is a first of its kind in New Jersey and will be one of 13 nationwide when it opens. On today's show, we will learn more about the advanced cancer care services offered by RWJBarnabas Health and Rutgers Cancer Institute, the state's only National Cancer Institute designated comprehensive cancer center, now under one roof, greatly enhancing both access and care for patients. We are pleased to welcome Dr. Stephen Labuti, the William N. Haight Director at Rutgers Cancer Institute and Senior Vice President of Oncology Services at RWJBarnabas Health. Welcome to the show. Thank you, Dr. Labuti, for being here. Now, for the audience, can you tell us a little bit about your background and what you currently are doing?
Sure. I'm Stephen Labuti, the director of the Rutgers Cancer Institute of New Jersey. I am Senior Vice President for Oncology Services at RWJBarnabas Health. I've been at RWJBarnabas Health and Rutgers now for 8 years. I'm a surgical oncologist by training. Prior to coming to RWJBarnabas and Rutgers, I was at Montefiore Medicine in New York and the Albert Einstein College of Medicine. And prior to that, I spent almost 14 years at the National Cancer Institute in Bethesda, Maryland.
Well, thank you, and thank you for what you've done. You've come through a lot with everything. Now, can you tell us a little bit? RWJBarnabas Health and Rutgers Cancer Institute, which are the state's only National Cancer Institute designated as a comprehensive cancer center, has just, as of this spring, are opening up the Jack and Sheryl Morris Cancer Center. Can you tell us a little bit about that center, what brought us to this, and how it's going to improve cancer health?
Sure, I'm happy to. So the Jack and Sheryl Morris Cancer Center, when it opens in May, will be New Jersey's first freestanding cancer hospital. And what I mean by that is it is a facility entirely focused on the cancer patient, from outpatient care to inpatient care, imaging, exam rooms, infusion chairs, radiation oncology facilities for radiation treatment, all under one roof, including 96 inpatient beds and 9 operating rooms. And so it is a facility entirely focused on the cancer patient and developed to help support the cancer patient through every component of their journey, from their cancer diagnosis all the way through successful treatment. And in addition to all of those clinical infrastructure that will be in the Jack and Sheryl Morris Cancer Center, there will be brand new basic science research laboratories, adding to the laboratories already at the Rutgers Cancer Institute, allowing us to drive the discovery of new approaches for treating cancer. And so this is really a landmark and foundational event for the state of New Jersey. There are no other freestanding cancer hospitals in New Jersey, and it puts us in a very small group. There are only 13 freestanding cancer hospitals, counting the Jack and Sheryl Morris Cancer Center in the United States.
So as a surgical oncologist, what are your thoughts?
Well, this is incredibly exciting for me. I haven't been in a facility that's even close to what we've done here at the Jack and Sheryl Morris Cancer Center. The closest I've ever come is the time I worked at the National Cancer Institute and in the clinical center at the NIH, which is a facility focused on clinical research. This facility truly is the epitome of the two sides of a very important coin in cancer care. That is exceptional care delivery and cutting edge treatments. And on the other side of that coin, paradigm shifting and driving research that is going to help us with the next generation of therapies for patients with cancer. And so this has been a dream of mine for many years, and it's finally coming to fruition. I believe this facility will not only aid us in providing the best level of care for the patients in New Jersey, but be a destination for patients across the United States as they come to see the best practitioners practicing cancer care in the best possible cancer facility. And so it's really incredibly exciting that we're about to launch it.
And also I hear that it is patient-centered, and that can you tell us about that and why the services offered will enhance the patient experience?
So every aspect of the design of this facility was informed by and focused on the cancer patient. And what I mean by that is we looked both from an aesthetic perspective and a functional perspective to immediately lift the burden of the cancer diagnosis off of the shoulders of our cancer patients from the moment they step foot in the facility. The goal is to wrap a blanket around those patients by having navigators that will help to collect all the information that that patient may have had already obtained about their diagnosis and have that ready for evaluation by our experts to make it seamless and easy for the patient to transition from outpatient care to inpatient care if it's necessary, and to have all of the important technical diagnostic capabilities that are needed by the modern oncology provider, PET scans, MRI scans, CT scans, et cetera, all in one place where that patient is coming to receive their care. And so every design element, every aspect of what we put into this facility was informed by feedback from our current patients and informed by our staff in terms of how we could best develop that optimal patient experience.
So the nice thing about this is this way the patient doesn't have to go from this facility to that facility to that facility, doesn't have to go to a radiology place to get the CAT scan, have to put it on a disc, bring it to the oncologist. It can all be done in one setting, and if necessary, the oncologist needs an extra view or something, can be done right then and there also.
Absolutely. So everything is built around the patient themselves to try to minimize the burden and the travel necessary for that patient. You know, we all know the impact of a cancer diagnosis and the fact that cancer doesn't travel well. And to this point, if a cancer patient wanted the benefits of a freestanding cancer hospital, they had to travel into Manhattan or into Philadelphia to get that sort of entirely enveloped approach to the treatment of that patient. And one of the advantages we have in the way that we designed this facility is we're connected by a sky bridge to the Robert Wood Johnson University Hospital, which is an acute care hospital. So if our patients have comorbid diagnoses, other diseases, or other chronic conditions that need to be addressed during the time we're caring for their cancer diagnosis, we're literally a stone's throw away from experts in all other areas of acute medicine to be able to bring to bear that strength on the care and treatment of those patients.
So again, one of the hardest things is if I have to tell a patient that they've got cancer, and at that point, basically the world stops for them. And at this point, prior to all of this, we luckily had Rutgers Cancer Institute down in New Brunswick where I can send people to. But what I've got now is even better than the Rutgers Cancer Institute, is I've got this freestanding cancer hospital, which has even more than what the Rutgers Cancer Institute had itself. Is that correct?
Yeah, in short, what you're getting now is the expertise of the providers and the cutting edge clinical trials as a result of the research being conducted in New Jersey's only National Cancer Institute designated comprehensive cancer center, now with a facility that is a part of the Rutgers Cancer Institute that allows those providers and those researchers to be doing their work in a state-of-the-art place that is focused on the care of the cancer patient. So we see this as another tool in our armamentarium for fighting a cancer diagnosis. And we recognize that there are probably no worse words a patient can hear than "you have cancer." If you're given just about any other diagnosis, you immediately begin to think about treatments that are going to cure it or allow you to live successfully with it. But cancer has a fear factor associated with it that this facility and the experts, both the clinicians and researchers at the Rutgers Cancer Institute, are determined to utilize to wrap that blanket around the cancer patient and begin to help them through that journey. So those words aren't the final say, that we, together with the patient, will be able to navigate them to a successful outcome.
And we will also have advanced technology, diagnostics available to these cancer patients?
Absolutely. So state-of-the-art imaging, as I mentioned earlier, state-of-the-art genomics, proteomics, other personalized tests that allow us to understand the unique aspects of the cancer that that patient has been diagnosed with, and a team of multidisciplinary experts that are working together all the time around a specific disease type, cancer type, to try to get that patient the best possible outcome. So medical oncologists working seamlessly with surgical oncologists and radiation oncologists, genetic counselors, other support staff that are of critical importance in helping to confirm the diagnosis and then select the appropriate care for that patient. And when traditional therapies have not been as effective as one would hope, have the ability to make available to those patients clinical trials that are testing the next generation of therapies, some of which are unique to the Rutgers Cancer Institute and have been discovered and developed in our own laboratories.
So again, we have the collaboration of everyone. We've got the nurse navigators, physician assistants, technicians, also even the nurses, the office staff, and we all are on the same electronic medical record, meaning that the handoffs are seamless also. We're able to give that patient the best possible care necessary and best for them for the cancer, so that we can hopefully say to the person that, yes, we've cured this cancer and you're okay at this point.
Absolutely. That is our vision, it's our mission, and it's the goal. Facility is there to facilitate. We have the experts, we have the knowledge, we have the cutting edge research behind us in terms of approaching patients, even with the most complex cancer diagnoses. And now we have a facility that will live up to the promise of that expertise and what patients in New Jersey deserve. Patients in New Jersey shouldn't have to travel over bridges and tunnels to get the exceptional care provided in an exceptional facility. And now we can meet that promise to the people of our state.
And we're able to do it in our community, which means that they don't have that hour-and-a-half trip and to try to find parking spots and pay $20 to find a parking spot, then to go back home and have to come back the next day and do the same thing over and over. They're done in their own community. Now, I hear that in the Institute, there are also going to be patient amenities that can help promote patient healing. Is that true?
That is. And so within the Jack and Sheryl Morris Cancer Center, There will be supportive functions such as patients that may need wigs, or patients that may need other amenities that help through their cancer journey will be available right there. There'll be some retail space in the facility. There'll be food services for their family. Much of this has been focused on the patient and their family, because the family plays a critical role in helping to support the patient through their cancer journey. And so there will be many amenities throughout the Jack and Sheryl Morris Cancer Center to help support the entire family unit. We have pediatric cancer care within the Jack and Sheryl Morris Cancer Center, a set aside and specific pediatric oncology unit within the Jack and Sheryl Morris Cancer Center that I'm particularly excited about. It is themed around a visit to the Jersey Shore, complete with a boardwalk and an arcade and a toy store and other things that hopefully will address some of the fear and anxiety that our youngest patients experience, and help parents support the siblings of those children that are undergoing care to make it less of an anxiety-provoking experience when they come to receive their care. So another example of the amenities that have been built in to the Jack and Sheryl Morris Cancer Center.
And I hear there's also going to be 10 additional state-of-the-art research labs in the facility also. How is this going to enhance the ability to translate that research into clinical practice?
Yeah, so I'm particularly excited about that component. Having spent the early part of my career at the National Cancer Institute in the intramural program, I became accustomed to the benefits of having science conducted in the setting of clinical care delivery, and clinical care delivery being conjoined to where that exciting research was being performed. And we've now achieved that juxtaposition in the Jack and Sheryl Morris Cancer Center. Those 10 additional PI laboratories will support over 100 investigators and their support staff in driving new cutting-edge research to complement the researchers that we already have at the Rutgers Cancer Institute. It's going to allow us to recruit the best and brightest minds from around the country here to New Brunswick to be able to focus on the cancer problem and to develop and design the next generation of solutions that hopefully will continue to drive us on a course to reducing the impact of cancer on our patients.
And in addition, I also hear that there's going to be advanced clinical trial infrastructure. Can you tell us a little bit about the oncologic clinical trials offered at Rutgers Cancer Institute and at RWJBarnabas Health?
I'd be happy to. So we're very proud of our clinical trial infrastructure. It's an infrastructure that allows clinical trials to be performed across all of our sites across RWJBarnabas Health. Again, meaning that patients don't have to travel to one particular site to gain access to most of our clinical trial portfolio. At any given time, we have active almost 200 clinical trials, each focused on a specific type of cancer and a specific subtype relating to stage or particular profile of a cancer. And all are testing next generation therapies for patients. We have the capability at the Rutgers Cancer Institute and the Jack and Sheryl Morris Cancer Center to make available cutting-edge immunotherapies, which are harnessing the patient's own immune system to fight cancer, some of which are based on cellular therapies, which take the patient's own immune cells and in our facilities approved by the FDA as good manufacturing policy facilities, where we can genetically engineer their own immune cells to specifically attack their particular cancer. And all of these capabilities are available under one roof at the Jack and Sheryl Morris Cancer Center. So we're very excited about how our clinical trial infrastructure will be able to support research not only in New Brunswick, but across the entire RWJBarnabas Health System service line, touching thousands of patients each year.
So as a physician in the community, I'm part of RWJBH, but I have friends, of course, who are not part of it. How am I going to have patients access this center so that they can get the best possible care?
So there are many routes that can lead to our experts and to the Jack and Sheryl Morris Cancer Center. One is our central call center, 1-844-CANCER-NJ. And a patient or a provider, a referring physician, can call that number and the phone will be answered by a living person. This is not a phone number you call and you go through a series of phone trees to be able to get to an actual person. An actual person will answer the phone, get an early assessment of what type of cancer the patient has and where the patient lives, and immediately transition that call to one of our expert navigators who are experts in the particular kind of cancer the patient has, and will get that patient to the closest facility to where they live that has the level of expertise that can handle the problem that they're facing. So we think of it as many doors to one program, and that call center is one point of access. But if the referring doctors are familiar with a particular provider or a particular location, they can feel free to use the means by which they access those folks. And then those folks will be able to properly navigate the patient to where they can receive the best care. So our whole goal here is to lower the barrier to access and to make it easy to be able to get navigated to this level of NCI designated comprehensive cancer care.
Can you give that number out again so the audience knows what that number is?
Absolutely. 1-844-CANCER-NJ.
So a great number to keep in your phone book or on your cell phone. Hopefully you never have to use it, but at least it's an easy way to get to a nurse navigator to get us into the system if you're not a patient who's part of RWJBH.
Absolutely. And I love the fact that you mentioned again or called out again our nurse navigators. We have a robust nurse navigation program. In fact, it's the second largest in the United States. And so we're very proud of our navigators and proud of the work they do every day on behalf of our patients.
Thank you. The nurse navigators make the world a much safer place for all of us. And they are terrific when you call them. They're very knowledgeable and they really do help you get through this hard journey. RWJBH as well as the Rutgers Cancer Institute have made significant investments in the oncologic services across New Jersey. Can you tell us more about these investments that they've made?
Absolutely. So we look at our oncology service line as an ecosystem for the care of patients with cancer, as I mentioned, in New Jersey and beyond. And all doors lead to this program. And so the health system, in addition to the Jack and Sheryl Morris Cancer Center, have made significant investments in other brick and mortar facilities, and obviously the recruitment of incredibly talented providers that are experts in specific types of cancer. Two examples of additional infrastructure investment are the Melchiori Cancer Center in Livingston, New Jersey, on the campus of RWJBarnabas Medical Center, and the Cancer Center at the Vogel campus in Tinton Falls, New Jersey, near Monmouth Medical Center. These are two state-of-the-art outpatient cancer center facilities that also have multidisciplinary care, one-stop location for patients with cancer, for imaging, for infusion therapy, for radiation oncology treatments, and to see the multidisciplinary teams of experts that are focused on their particular cancers. And so these facilities help us to deliver on our promise that patients won't have to travel great distances to engage with our experts. And we navigate patients within our system, that if a patient has a problem that is of a level that it needs the expertise of inpatient cancer hospital care, patients can be seamlessly navigated from one of our facilities across RWJBarnabas Health to the Jack and Sheryl Morris Cancer Center. So I'm very proud and grateful to our system for the vision and the investments that have been made over the last 8 years as we continue on our journey to be the destination for cancer care, not just in New Jersey, but across the country.
Well, we're very proud of the leadership at RWJBH. We're proud also of your leadership in doing everything that you've done to basically get this freestanding cancer hospital established and to hopefully make RWJBH the place that everyone wants to come to, not only for cancer, but for all medical care necessary and proper, because they do have the best quality physicians, best quality staff, best quality nurse navigators, best clerks, best people who are in the janitor staff. We couldn't do anything if we didn't have the type of people who are working at RWJBH, and it just shows you how good this leadership is, that they understand this and that they're working to improve even the best possible care.
Absolutely. And we take seriously every day the notion of one system, one family. And that word family truly resonates with all of us. And every member of that family plays a critical role in making certain that our patients have the best care and the best outcomes possible. And so it's a privilege to be part of this organization and to play even a small role in helping us to succeed on behalf of the patients that we serve.
As we're concluding this episode, can you give us a key message as what our audience should know about the cancer services at the Rutgers Cancer Institute, RWJBarnabas Health, at the Jack and Sheryl Morris Cancer Center, and the fact, of course, that the Rutgers Cancer Institute is the only designated comprehensive cancer center in New Jersey?
So we're here for you is my message. We're thinking about, we're focusing on, we're making progress in the treatment of cancer every day. It's a privilege to be engaged in that fight to try to improve the outcome of patients diagnosed with cancer. And so we are here for you to help lift that burden off your shoulders, put the anxiety, put the uncertainty on us. And we will do our part and work tirelessly every day to make sure we can help you get through what is often a very challenging words to hear. You have cancer. And our entire mission is to make certain that we get you the best possible outcome that we can right here where you live. And so many roads lead to the Rutgers Cancer Institute and to the Jack and Sheryl Morris Cancer Center, and we are here to serve you.
And again, one system, one family.
That's right. One system, one family.
Thank you for being here. Thank you for everything that you do for RWJBH. Thank you for what you do for cancer. Thank you for, again, all of your expertise as a surgical oncologist leading to the development of the Jack and Sheryl Morris Cancer Center, which is the only freestanding cancer center here in New Jersey and only one of 13 throughout the United States. Thank you for allowing our patients in New Jersey to stay in New Jersey and not have to go elsewhere to seek the best possible care necessary for their treatments. Thank you for everything.
Well, it's truly a privilege, and it's been a pleasure to have this conversation with you this morning.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about cancer services at RWJBarnabas Health and Rutgers Cancer Institute, please visit www.rwjbh.org/beat cancer.